So we are going to do a little fact-checking today. With me now to do that, Lori Robertson. She's the managing editor of factcheck.org, and I'm going to give you a plug for anybody who really wants to know what's right, what's wrong. I think it is an invaluable website, very nonpartisan. I think you are to be commended. Lori, I'd like to run through some questions, frankly, that have been raised by people at a lot of the town halls and get your opinions. Some from the president, some from regular people. The first one is listening to the president of the United States addressing the monetary aspect of health care reform.
It's about $100 billion a year to cover everybody and to implement some of the insurance reforms that we're talking about. About 2/3 of those costs we can cover by eliminating the inefficiencies that I already mentioned. So I already talked about $177 billion worth of subsidies to the insurance companies. Let's take that money. Let's put it in the kitty.
Okay, Lori, hold his feet to the fire.
Well, the president does continue to say he's not going to sign a bill unless it's paid for, but the fact is right now the bills in Congress aren't paid for. The nonpartisan Congressional Budget Office has said that both the House and the Senate bill will add hundreds of billions of dollars to the deficit over a decade. So Congress is still trying to figure out how to do that. Obama says he has identified these ways to save money, but identified is the key word. There are estimates, can that really happen? And some of the ways he's identified to save money aren't yet in these bills, and they involve Medicare and can be some tough things to get through Congress.
Well, so talking about tough things to get through Congress, let's talk about something else the president had to say with regard to withholding testing or procedures. Let's take a listen.
If we've got a panel of experts, health experts, doctors, who can provide guidelines to doctors and patients about what procedures work best in what situations, and find ways to reduce, for example, the number of tests that people take. These aren't going to be forced on people, but they will help guide how the delivery system works so that you are getting higher quality care. And it turns out that oftentimes higher quality care actually costs less.
I mean, Lori, I know he's right. We waste a lot of money, and there are outcomes research and smarter ways to do what we're doing.
And I think the fear here, this stems back to claims made when the stimulus bill was being passed, that it set up a board that was going to tell your doctor what he or she can and can't do.
Well, sort of like the Federal Reserve, some independent, nonpartisan board.
And it was not true. There was concern about a council that would oversee comparative effectiveness research set up by the stimulus bill, and that is research into which procedures work best and in some cases are most cost effective. But the stimulus bill specifically said that this council would have no power to mandate treatment or insurance coverage.
Lori, this from a person who was in a town hall linking abortion issue to health care reform.
To pay on a health care plan that includes the right for a woman to kill her unborn baby. Is it true that this plan is in the health care bill?
So?
Well, there is nothing in any of the bills that say abortion must be covered. And there's one version of the House bill that explicitly says federal funds can't be used to cover abortion. But this is a little bit of a gray area. Anti-abortion groups still want a more explicit language saying that no taxpayer money would be used to cover abortion. And the concern is that if you are getting some government subsidies to help buy your insurance coverage and your insurance pays for or would pay for an abortion, how do you separate out those subsidies you receive from the private money you may be paying toward those premiums?
Important for everyone to know what the hell they're talking about these days. Lori Robertson, thank you so much. Factcheck.org. I appreciate you being with us. You bet.